Beyond the blues understanding depression, we all experience sadness. It's a natural human emotion, a response to loss, disappointment, or hardship. But what happens when sadness lingers, casting a long shadow over our lives? What happens when it's no longer just a passing feeling, but a persistent darkness that clouds our every thought and action? This is where we step into the territory of depression, a complex mental health condition that extends far beyond the realm of everyday blues. Depression is not a sign of weakness, nor is it a choice. It is a medical condition, just like diabetes or heart disease, with biological underpinnings and a profound impact on an individual's well-being. Understanding this distinction is crucial for fostering empathy, reducing stigma, and encouraging individuals to seek the help they deserve. When sadness lingers, distinguishing depression from everyday blues. While sadness is a normal and temporary emotional response, depression is a persistent state of low mood and loss of interest that significantly impairs daily life. Imagine a day filled with your favorite activities, spending time with loved ones, pursuing hobbies, or simply enjoying a sunny afternoon. Now imagine these activities losing their appeal, replaced by a pervasive sense of emptiness and apathy. This is a glimpse into the experience of depression. Distinguishing between sadness and depression lies in the severity, duration, and impact on daily functioning. Sadness is like a passing storm, leaving behind a sense of relief when it clears. Depression, on the other hand, is more akin to a heavy fog that settles in, obscuring joy and making it difficult to see a path forward. Importantly, sadness typically resolves on its own, while depression often requires professional intervention. Unmasking the darkness symptoms of depression. Depression manifests in a myriad of ways, impacting not only our thoughts and feelings, but also our physical well-being. While the experience varies from person to person, there are common symptoms that can help us recognize and understand this complex condition. At the forefront is a persistent low mood, a feeling of sadness, hopelessness, or emptiness that lingers day after day. Accompanying this low mood is a loss of interest in activities that once brought pleasure. Hobbies, social gatherings, and even simple joys lose their appeal, replaced by a sense of apathy and indifference. Sleep patterns are often disrupted, with individuals experiencing either insomnia or excessive sleep. Fatigue and low energy levels are common, making it difficult to engage in daily tasks. Inside the depressed brain. A look at the physical manifestations. Depression is not simply a state of mind, it has tangible roots in the physical structure and function of our brains. Research has revealed key differences in brain activity and neurochemistry between individuals with depression and those without. For instance, brain imaging studies have shown that certain areas of the brain, such as the hippocampus, involved in memory, and the prefrontal cortex, responsible for planning and decision-making, tend to be smaller in volume in individuals with depression. These structural differences are accompanied by imbalances in neurotransmitters, the chemical messengers that facilitate communication between brain cells. Serotonin, dopamine, and norepinephrine, all crucial for regulating mood, motivation, and reward, are often found to be dysregulated in depression. This intricate interplay of structural and chemical imbalances underscores the biological basis of this condition. Unraveling the knot causes of depression, genes, environment, and beyond. While the exact causes of depression remain a subject of ongoing scientific exploration, a growing body of evidence points to a complex interplay of genetic predisposition, environmental factors, and life experiences. Just as some individuals are genetically predisposed to certain physical health conditions, so too can genes influence our vulnerability to developing depression. However, genes are not destiny. Environmental factors such as childhood trauma, abuse, neglect, or chronic stress can significantly increase the risk of depression. Life events such as the loss of a loved one, job loss, or relationship breakdown can also trigger depressive episodes, particularly in individuals with a pre-existing vulnerability. Understanding these multifaceted causes is crucial for developing effective prevention and treatment strategies. Breaking free, seeking help and treatment options. The first and most important step towards recovery is acknowledging the need for help. Seeking professional support is crucial for receiving an accurate diagnosis and developing a personalized treatment plan. Just as we wouldn't hesitate to consult a doctor for a physical ailment, we should approach mental health concerns with the same level of care and attention. Fortunately, a range of effective treatment options are available, each tailored to the individual's specific needs and circumstances. Psychotherapy, also known as talk therapy, provides a safe and supportive space to explore thoughts, feelings, and behaviors that contribute to depression. Cognitive behavioral therapy, a widely used form of psychotherapy, helps individuals identify and challenge negative thought patterns and develop healthier coping mechanisms. A helping hand, supporting a loved one with depression. Supporting a loved one with depression can feel daunting, but even small gestures of kindness and understanding can make a world of difference. Start by educating yourself about the condition. The more you understand about depression, the better equipped you'll be to offer empathy and support. Encourage your loved one to seek professional help, emphasizing that it's a sign of strength, not weakness, to reach out for support. Practical assistance can also be invaluable. Offer to help with everyday tasks such as grocery shopping, cooking, or childcare, as these can feel overwhelming for someone struggling with depression. Be patient and understanding, recognizing that recovery is a journey, not a destination. Most importantly, let your loved one know that you're there for them, without judgment or pressure. Shattering the stigma towards open conversations and understanding. Stigma thrives in silence. By fostering open and honest conversations about mental health, we can chip away at the shame and prejudice that prevent individuals from seeking help. Talk to your friends, family, and colleagues about mental health. Share your own experiences if you feel comfortable doing so, and encourage others to do the same. Challenge misconceptions and stereotypes. Depression is not a sign of weakness, nor is it a choice. It's a medical condition that deserves the same level of understanding and compassion as any other health concern. By working together to reduce stigma, we can create a society where seeking help for mental health is as commonplace and accepted as seeking help for physical health.